My name is Leanne. I'm one of the critical care paramedics here at Waverly Health Center. Been a paramedic for 23 years and I've worked at Waverly Health Center for the last 2. So typically when we're responding to a call, there's 2 of us. Usually an EMT or another paramedic is with us. When we get to a call, we kind of do a scene size up is what we typically do, depending on even if it's a house. Just make sure their surroundings are safe for us. Once we do come in contact with a patient, we usually start our assessment the minute we lay eyes on our patients. And it kind of guides us which direction. Either we can stay on scene and treat our patient, or if we see that our patient is very sick, then typically it's a more rapid response of quickly gathering the patient and getting them out to the ambulance so we can provide them with the best care and the interventions that we need to do. So here in Waverly Health Center, not only do we run 911s and inter-facility transfers, but we do assist in various areas of the hospital. We help out in the emergency department with patient care. I enjoy, I guess, the various areas I get to assist in. We get to help everybody from newborns to our elderly. We get to work alongside doctors, CNAs, LPNs, RNs, and we get to see the gamut of healthcare, I guess, from a different perspective. I feel like a misconception with EMS is that we put you in the back of an ambulance and drive you to the hospital, when our ambulance is actually a mobile hospital in itself. So when you call 911, you're not just getting a ride, you're actually getting a lot of treatments that can be started in the field before you get to the hospital. And what we discover and kind of assess is also really important, because when we get to the hospital, it gives them the idea of what needs to be done and how the patient needs to be treated. We are like a really close-knit family. You get to work with your, I guess, besties on a daily. But having that camaraderie with them is so important going forward when you're on these calls and managing some very difficult situations. Making a difference in someone's life is really important to me, and I feel like that's been my drive from the very beginning of